But before I explain vessel, let's little bit revise muscle and topography, because without that thing you cannot understand my story. Let's see. Here it is axillary cavity. You know that axillary cavity formed by some muscles behind subscapular latissimus, medial side serratus muscle, anterior side it is the pectoralis major muscle, lateral side is the muscles of arm, coracobrachialis, brachialis. In our axillary cavity we distinguish three triangles, but not so enough, not convenient to show it here. And we distinguish two foramen, quadrilaterum and trilaterum, if you remember. But this is a tendon of latissimus dorsi together teres major muscle. But this is a subscapular muscle, this is a triceps tendon, and this is quadrilaterum, and this is trilaterum foramen. If it wrote, it is a humerus, this bone, this is a triceps, that muscle, this is latissimus, and this is subscapular. Quadrilaterum, trilaterum. Look it. Quadrilaterum, trilaterum. Okay? And let's see which vessel go in that foramen. In quadrilaterum, we can see what it is axillary artery. From axillary artery, what? This artery which go to quadrilaterum foramen, it is circumferent humeral artery. Posterior circumferent humeral artery. Quadrilaterum. In trilaterum, we can see from artery going subscapular artery, this big artery, which give branches. One of that go to trilaterum, circumferent scapular artery. But that is visible on camera.
Yes.
Circumferent scapular artery goes to trilaterum foramen. And one branch go to latissimus dorsi muscle, thoracodorsal artery. To serratus muscle passes lateral thoracic artery, but on that prepared is not so visible. To the notch of scapula going suprascapular artery. On this is the nerve and vessels lower. This is. Now let's see arm region. Our arm consists of two compartments of muscle. Flexor, biceps coracobrachial, or this is the biceps. Look, this is coracoid process. It is a short belly, short head of biceps. This is a long, going under capsule of shoulder joint. Biceps muscle, this is coracobrachialis muscle, it is brachialis muscle. Let's remember, no, triceps of course that side. Let's remember topography. Beside of biceps there are two grooves, lateral and medial. In lateral groove passes subcutaneous vein, cephalic vein, it name. In Latin name, vena cephalica, cephalic vein, okay? Only subcutaneous vein, nothing else. In medial bicipital groove, a lot of structure. Look it, visible on camera, that side. It is the main bundle of vessels and nerves. And now I teach you how to distinguish nerve vessel, not confuse. Look, it is a nerve, median nerve. When I touch it, no lumen. It is not flat because nerve don't have a. What our vessels, like vein, they have a lumen. Artery looking like this because elastic fibers a lot don't give flat teeth. Understood? That's why if I take artery and vein, they are different. And nerve, they consist of many fibers and not flat. That's why if I touch and I can see some fibers, it is visible. If I touch that thing, this is the artery. Look it. Beside brachial artery. Beside we can see enlargement. Like this I draw. Enlargement here and here. If I take vein, you will see differences. Vein is flat, totally flat. artery
Also
not so flat. It's flat but not so flat like vein. Look,
thin
hmm?
thin thick.
Thin or thicker, yeah, right. But sometimes thin or thick cannot help because if you're talking about big vessel, you will not can distinguish. Axillary artery. This is an axillary vein. Axillary vein. Okay. Now our brachial artery passes in the middle bicipital groove. Then come to the cubital fossa. Cubital fossa, it is a fossa which formed by pronator teres muscle below. This is pronator teres. No, damaged pronator teres. Brachioradialis muscle lateral side, and upper it is brachial muscle and biceps. Cubital fossa. In the center of cubital fossa there is a brachial artery and median nerve. It is the contents. Now, of course, lymph node also. And now we see bifurcation. Look it. Ulnar artery go under pronator. A radial artery goes superficially between brachioradialis muscle and flexor carpi radialis muscle. It is a radial groove of forearm. Now let's revise topography of forearm. Before that we revise cubital fossa. Now forearm. I wrote here. There are ulnar groove, median groove, radial groove. Ulnar groove, it is between flexor carpi ulnaris, flexor digitorum. Let's find them. Flexor carpi ulnaris muscle, flexor digitorum, ulnar groove, ulnar artery together with vein beside of it. This is ulnar vein 1 second, 2 veins, but 1 artery. Deep vein, they have the same name like artery and they doubled. No, of course there are some exceptions. For example, axillary single. This is a nerve, ulnar nerve. This is the ulnar groove which I wrote before. Next groove between flexor digitorum and flexor carpi radialis. Flexor digitorum, flexor carpi radialis. Median groove for median nerve, but it is a future next semester topic. Tantrika next semester. Let's see the groove, radial groove. Look it between flexor carpi radialis and brachioradialis muscle. This radial groove. Radial artery passes. Look it. Brachial give us ulnar and give us radial. It follow this groove. Okay. Now let's see what happened further. Let's start from radial artery. Radial artery, we can feel pulsation. If we push this place between bone and the tendon, we can feel pulsation of radial artery. After that, radial artery, this is a big branch of radial artery, superficial palmar artery. But now I tell you about radial proper. Radial artery goes under tendon of extensor carpi muscle, extensor carpi muscle tendon. Then it goes in a snuff box. Okay? Sorry, I confused. Not extensor carpi. It is a muscle which move thumb. It is abductor pollicis longus and extensor pollicis brevis. Abductor pollicis longus, look it, and extensor pollicis brevis. This is extensor pollicis longus and snuff box between that tendon. Artery here, radial artery. Snuff box, if you use your hand, extensor longus, extensor brevis, snuff box here, and radial artery we can find here. Okay? After that, radial artery again come back to the palmar surface, but we cannot see it because it is really deep. What we can see here? Let's see ulnar artery. Ulnar artery, after bifurcation, goes under pronator teres, then come under muscles and goes in ulnar groove, come to the hand and the retinaculum, and we can see ulnar artery here. Ulnar artery flex like arch, and anastomose with one what it, that muscle goes inside on the short flexor and what short flexor and short abductor under it, and make an arch. This arch called superficial palmar arch. Superficial palmar arch, I write it, made by ulnar artery and one branch of radial artery. That branch called superficial palmar branch because it is superficial palmar arch. Okay, from superficial palmar arch going arteries. What here? Common digital artery. They directed to the space between finger. Every space between finger directed by that artery, and then they bifurcate again and give proper digital artery. Understood? Each finger receive by side proper digital artery. Palmar. Also there are dorsal, but they smaller. All vessels passes if we see. No, I will write it. Let it be finger, nail. It is the distal phalanges, middle phalanges, and proximal phalanges. Arteries passes side palmar arteries like this, and they also supply distal. Dorsal arteries not so big, they just supply proximal and middle phalanges, dorsal surface, but all together they passes on side of finger. Side of finger. That is why when we make cutting by knife, surgical knife, we use this. We don't cut middle side because tendon here. We can damage tendon. We cannot use side because we damage vessel. We use paracentral line, this, that. And we can open surgically access to what we need to do for infection removing or something like that. Okay? Now I revise you. What axillary artery is a continuation of subclavian artery. A subclavian artery, you know, left start from arch of aorta, right from brachiocephalic trunk. After that continuation, calling brachial artery, then bifurcation ulnar and radial, and then we can see they make a superficial palmar arch. This arch situated, look, this is a preparatus. We see skin is removed, fat is removed, and fascia is removed. Fascia, this area called palmar aponeurosis, because tendon of this is a superficial palmar muscle. This is her tendon inserted to the fascia, and that is why this fascia called aponeurosis, palmar aponeurosis. And under that tendon, what imagine we already removed skin, fat, fascia, and we see again fat, what like this, but it is removed by students, and now we see what under. We see vessels, we see nerves, we see tendon, but under it there is one more muscle, lumbricaris, and under it one more, not visible, interosseous, and between this superficial tendon and interosseous there is one more arch, but they call deep arch. Understand? This is the superficial, there is one more deep arch formed by radial artery and deep branch of ulnar artery, and deep arch little bit proximally. If we projected superficial palmar arch, they projected to the middle of, or this is the metacarpal bone base, middle head like this, middle of metacarpal bone like this sulcus, you know it, that is flexor. But deep arch, they projected to the base, it is almost here, but under the tendon, understand? Superficial projected to the middle of carpal bone, are deep projected to the base of carpal bone. Now let's see some branches. Of course, vessels reached by branches. Let's see what we can. Before that, I already showed you. You will see video. Now let's see branch of brachial artery. Brachial artery give branch which together with radial nerve passes to the brachiomuscular canal. It name deep brachial artery. Okay. One more we can see of this artery. Each give branches to the muscle. Also from brachial artery should goes collateral. Ulnar collateral inferior and superior should be here, damaged. Understood? That's why I repeat. The biggest branch it is a deep brachial artery. Also there are small branches like collateral ulnar arteries. Branches of ulnar artery, we can see recurrent artery. Collateral, they anastomose with recurrent and make a network for blood supply of elbow joint. Also from radial we can see recurrent artery, like this. You can see. Also from ulnar artery going common interosseous, what this is, which give us interosseous artery. Interosseous membrane, let's see it. And if you see interosseous membrane, you will see deep artery, which called anterior interosseous. Look it. I remove all muscles and we see radius and ulna. It is an interosseous membrane. And this is nerves and vessels. Anterior interosseous nerves and vessels. Deep located branches of ulnar artery. Okay. About branches which make palmar arches, I already said. Common and also branches of two fingers, I am also said. Now let's talk about veins. As I already said, our deep vein, same name like artery. Ulnar, radial, brachial, axillary. But on the same location, they together passes. But on the skin there are subcutaneous veins. Two big veins, usually. Cephalic vein and basilic vein. Basilica, cephalica inlated, okay? In this preparatus, we can see only cephalic vein. This is cephalic vein, and the skin it passes. It starts from the dorsal network of hand, then go laterally, then in the lateral bicipital groove, then groove between pectoralis major muscle and deltoid, and then inserted to the axillary vein. Basilica vein start from the ulnar surface. What that is basilica vein? Going, and inserted to the brachial vein. Basilica vein from skin, from fascia, inserted to the brachial vein. That's it.